now, and now it is live. And yeah, there we are. I'm going to change the view here so that we can see you the whole time. And let me make sure that also went up. And there we are. Yes. All right. So we are live. It's always a technological feat that this happens. And I am so excited. This is my first interview in a long time here on Facebook with a person that we've just met over Twitter and online. So this is really exciting. For everyone joining us, if we haven't met, my name is Julie Hirschberg, the owner and founder of Re+active Therapy and Wellness in the Los Angeles area. And I join people, you all live with what we're learning and doing and growing with every week on Fridays over lunch. It's a little lunchtime chat. And I learned a lot from Max this week. And so I reached out after reading her blog, and she was so generous to come and share. I will share that I am a bit under the weather, so I am going to talk less and listen more, because also Max has a lot of great insights to share on FND. And she wrote this wonderful blog post. By the way, her blog can be found at fndrecovery.com. But the blog post was Distraction, the key to automatic normal function. And if you watch my videos much, I talk about automatic movement all of the time. It's something I'm really passionate about. How do we unlock this for people with neurologic disorders? And Max just had a really great perspective. I'm so excited for her to share it. And Max, I will have you first just introduce yourself and a bit of your story and why you wrote this particular blog.
Well, I have FND myself, and I first started having symptoms way back in October of 2000, and my symptoms started with non-epileptic seizures. I spent a week in the hospital, and in 2000, it was dark ages, and they pretty much very quickly, which is unusual, I suppose, they said I had conversion disorder, and I was professionally, I am a physician assistant, and I had never heard of that. But of course, I started researching. There were not many articles back in 2000 on it. And what was there did not make much sense to me. It said people who had this were uneducated, very naive. And I thought, no, this does not fit. And this was such a physical thing. And I think this is the thing that's so hard for people who have functional neurological disorders to accept. This is a very real, hugely physical thing, yet it does involve a lot of our minds, and that's what I use to help myself get better. So early on, I went through a really hard year and a half, trying to find any kind of treatment, even understanding, even a speck of kindness, and I didn't find very much. And so I swore to myself, if I could ever make somebody else's journey through this easier, I would. And so that's my blog is a result of that promise I made way back in October of 2000. I actually got my seizures sort of under control, and I ended up working for about another 10 years and functioned fairly well. I did, a few months after my seizures, I did start developing some mobility issues, but those, after a few months, sort of resolved as well. And at that point, I can't say this is what fixed me. It just was sort of one of those lucky magical remission things that sometimes people go through. I did follow the advice of everybody of, go see a psychiatrist, go get therapy. I did do those things. I do have a history of childhood trauma, and I do think that has a lot to do with why I have FND. Part, I think, poor brain development, and part just the way I look at the world and the way I we all have these things that we don't even recognize in ourselves sometimes, but digging out through some of those things has helped me quite a bit. Around 2012, my mom got a diagnosis of frontotemporal dementia, and her father had died of a neuropsychiatric illness. So when I started researching that, I thought, now maybe this is what all my neurological problems have been about. Maybe it wasn't that conversion disorder thing after all. And so I reluctantly went and saw another neurologist who agreed. And for about 5 years, I carried a diagnosis of FTD.
Mm.
I got bad very quickly. And I think for those of us with FND, if we allow ourselves to think I'm really, really bad and I'm getting worse, that self-fulfilling prophecy, that happens to a lot of us. So within, let's see, by summer 2015, I had moved into assisted living. I was in a wheelchair. I was losing my speech. I was about as low as you can go. I was participating in some research on FTD in California, UCSF, and I'd been in their studies for quite some time, and it was getting hard to travel. So I had one final visit with them, and I said, I'm not going to do this anymore. And while I was there, they said, we don't think you have FTD. I was like, what? Well, what do you think I have? And they were reluctant to name it. Sometimes I think of Voldemort, he who cannot be named, because many of us with FND, that's how it is. They don't want to tell us what it is we have, and just say it, functional neurological disorder. So they sort of beat around the bush, but I went home and my neurologist said, did they say functional? I'm like, yeah, I think maybe. And so I found that was newer terminology. So I couldn't accept it. Again, this was so real. Good grief, I'm in assisted living. I can't walk, I can't talk. Of course, this is real. I'm not somebody that would just let this happen to me for no reason. But there was this little piece inside me that thought, remember back 15 years ago when you weren't doing well and then you got better and you could live your life again? Maybe that could happen. What if they were right? And that little question of what if just got me doing some research. So at that time, in 2015, the internet was so much kinder than it was in 2000. And I found some articles, and I found John Stone's website, neurosymptoms.org, which is a great resource, and FND Hope, and found other people who had this. And 15 years before, there was nothing. There was nobody. I was totally alone. I knew nobody else that dealt with this sort of thing. All of a sudden, there's this whole community of people around the world. So doing the research, I just started thinking, if it's possible, I want to get better. I don't know, and this is hard, and I can't believe I even could, but if I could, I want to get better. So the first thing I decided to do was see if I could help my speech get better. So I wheeled myself in the bathroom and looked in the mirror and thought, okay, I'm just going to work on speech sounds. I'd had a little speech therapy, so I thought, well, I can do that. But to my amazement, when I looked in the mirror, it all worked. And right now I'm looking at the camera. If my speech goes out, cell phones are great now because I just can selfie. And if my speech is sort of getting a little warbly, if I just watch my lips, and that's part of I haven't figured it all out yet, but my brain reconnects through looking
through the
at
mirror.
what my body's doing. So the speech thing, I mean, everyone was amazed. All of a sudden I could talk. I was always looking in the mirror, but I could talk. So we decided to try that out with my legs, and my husband set up a full-length mirror in front of our treadmill, and I'm hanging on for dear life. And I just watched the mirror and watched my legs, and it worked. It connected. And within a couple of weeks, I went from total disability to acting pretty normal. And then I decided, then I spent some time, I gave myself some time just to heal and try to figure out some more things. But I started my blog in 2017, 18, I think. And just because to fulfill that promise, because there are things we can do, but there are not enough easy resources. Neurosymptoms.org is a great one, but I just wanted to put together some things, and also to be vulnerable, because I think not enough people say, yes, I have this. And yes, I struggle with these things. And by addressing these things, it helps me function better.
Yeah, wow. But I read your story on the blog, and this idea of the mirror too, which is something that we use in therapy too, just brilliant, because it changes what the brain perceives too. And I know we also connected over Twitter because you shared that you were at the FND Society meeting, and we didn't get to meet each other in person. But that was some of the inspiration for the recent blog post you said was, seeing some of those examples talking about distraction or an external focus and how helpful that can be in reorganizing movement, right? And so there was, I'm such a fan of your blog and what you're sharing. I think it's so helpful, and your perspective. I wonder if you can share what at the FND Society meeting, what kind of inspired that blog post about the distractions as a way to open up automatic movement?
Well, I think I had written a post before about attention and how it's important for us to not be paying attention, which is the opposite of how most people live their lives. If we're not doing something well, focus, pay more attention to it. And in FND, that is the worst thing you can do, because the more you focus on what's not working, the more it doesn't work. And so that's part of I call it self-experimentation, that I'm always doing and always trying to find little tips and tricks that help me do things easier. Because even though I'm functioning pretty well, I still have FND, and still almost on a daily basis, I'll have just little glitches, like I might have walking along and a glitch freeze in my step, or we have a big hilly backyard and I'm walking up the hill and maybe my legs are feeling tired and draggy, and so I have to have those immediate little tricks to help me pull them together. And so I'd written that before, but during the conference, it struck me. There was one video, I don't know if you were there, if you remember, where a woman was just, you could tell she was struggling valiantly to help to work on her gait with her physical therapist. And then she was sitting down and her cell phone rang, and she just got up and grabbed her phone, and everybody laughed. And I remember talking to Tim Nicholson later. He says, we shouldn't have laughed. Somebody should have addressed that. It wasn't funny. And it's not funny. But at the same time, it was such a perfect example of just how bizarre FND can be, because it's why I think historically in the past we've been treated poorly, because someone observing us says, wait a minute, you walked pretty fine to get your phone. What do you mean you can't walk? Of course you can walk. And that doesn't make sense. But as someone who has it, I can tell you, she wasn't making that up. She truly was struggling to walk. But also what would be very cool, I don't know who saw her, or they use that and say, look at this. This is amazing. This is wonderful. And I think this is the key to helping a patient, to be respectful and caring and compassionate, to say, oh my gosh, did you see that? That was amazing. See, this is what I'm sort of telling you, that when you're working so hard, your brain is not going to that automatic pathway, but you were distracted by your phone. You weren't even thinking about walking. And look what happened. So that's what we have to grab. That's what we have to help you find, those ways to grab that part of your brain that knows how to do it. And you just have to be able to grab it when you need it. And so that's sort of my tricks that I have. When I need to grab that, when it's not working automatically, I go to, I'm not thinking about walking, I'm thinking about the top of the hill. I'm thinking about, I'm going to count by fives while I'm walking to the top of the hill. I'm going to do something else. So I can't think about walking to the top of the hill, because if I think about that, my brain doesn't want to do it. It's very stubborn. I think I call it a stubborn toddler sometimes. And I just, it's like a stubborn toddler. You figure out the tricks so that it does what you want it to do without it realizing it. And so that's what I do. I distract it with other things, and then it cooperates.
Yes. Brilliant. And I love how you use that term, like grab it. It's there, but it's almost like it's masked, right? And actually, the more you struggle and focus and think, the harder it is. Yeah.
And it's hard to explain that to people. And it's frustrating to have it, because we're used to trying harder. And I think many of us, like me, overachievers who are used to just striving harder when something's not working, and it doesn't work. You have to give up, sit back and let it happen, relax, get that anxiety state under control, and have yourself in a good mental space to be relaxed and let that automaticity take over.
Yeah. exactly. And I hope, through your blog, through a lot of other resources, this is coming to light. Like even, you think of things like the golfer's yip, or the twisties
Gymnast.
in a gymnast, right?
I actually have a good friend with FND, Sarah, and we have a monthly meeting. I went with her last year when she went through the Mayo Clinic program, just because I was nosy and wanted to see what they did and share some things on the blog. But she was a gymnast. She competed through at least middle school or so. But we talked about that when Simone Biles talked about the twisties or the yips. And I was just yesterday, Sarah and I were talking, and I said, the yips are FND. And she goes, yeah, absolutely. And it is. And I think that as we look more into FND, we'll see how many common experiences people can relate to are probably a bit of FND. And for those of us that have developed the full-blown disorder, some of those little idiosyncrasies of our brain have just sort of gotten out of control.
Right. Yeah. So well said. I just really love how you can articulate these concepts like way better than most, I think, neurologists even in the field. And
I used to say I was the world's leading expert on FND because I have it and I've overcome it. But after the conference, like, no, FND Portal is the world's expert on FND. I can be number 2. I'll be fine. But until you experience it, it's really hard to understand. And even experiencing it, there are lots of it that doesn't make sense. I remember early on when I was going through diagnostic hell, and a neurologist said, nobody thinks you're making it up, which was a relief because some people did say I was making it up.
Right.
But I said, if I was making it up, I'd do a much better job because I realize the inconsistencies. I realize it doesn't make sense, but yeah, it is what it is.
Yeah. Well, and a lot of healthcare providers subscribe to our newsletter, watch our videos. And I think this is such a good lesson. This is how I live my life as a healthcare provider. You are the world's best expert here. I learn more. Yes, I went to that conference, right? But just like you, the most I learned was from FND Portal, and so most of what he shares as well, and just in that presentation. So I think, again, because not all healthcare providers are, I think that the medical model is that we're the expert. We kind of go to school for a very long time, and you kind of go, well, now I'm the expert in neurology, or I'm the expert in this. And we're not. You are the expert, and you're the expert in your symptoms. You're the experts in understanding your own body and nervous system. And if we're working alongside of you, we might discover things together. But
there's a good healthcare provider. I think that is the key, because I can remember some of the insecurity I felt as a PA when I was confronted with something I wasn't very familiar with. And at first I would try to fake my way through it, and that didn't work out very well for anyone. And finally I kind of gave up and goes, you know what, nobody can know everything. And I just started asking questions. Tell me what that's like. Tell me how it started. Tell me what that feels like for you. And people like to tell their stories, but you learn so much more that way, and you're really more helpful meeting the patient on that level than to pretend you know something you don't. You're not fooling anyone.
No. What a great lesson. You're giving lots of nuggets for our fellow healthcare providers who watch this. Now, you already mentioned some of the things just in speaking here, like you got stuck going up a hill, some of the external focus or distraction that you might use. And you shared a lot of great things in that blog. So I wonder, what are some other ways, I think you used the term, you might mix up movement for when you get stuck?
Well, and this is something I guess I have done a little, but I run into a lot of people with FND now. And I think sometimes we can get just very stuck. Our bodies don't want to do what we want. And I think sometimes just letting it go and just moving. I think I was going to put some on Twitter, and I thought I try to be really careful. I don't want to come across as one of those, what's the new term? toxic optimism or something like that,
Mm,
you know, so because it is hard. It is hard, but
yeah.
sometimes I think if you can't walk, then dance. And I think sometimes just
Yeah.
moving what you can move and getting into that frame of mind where you're relaxed and your body is, you're enjoying the way it's moving, whatever is moving. And so if your legs aren't working, you can dance with your arms, but whatever you're doing to just get into some movement, I think is really helpful. I know one thing that has always been tough for me is if I'm down on the floor, it's hard to get up. And
Mm,
in the early days of my FND, I think this was a horrible thing. I had read so many things about secondary gain with FND that I believed them. And so I believed if I was stuck on the floor, I shouldn't call for help because that would be reinforcing my disability. So I would lay on the floor however long it took till I could get up again. And that was a horrible thing. That was a horrible thing to do to myself, to not allow myself human connection and caring of my family to help me getting up. So let go of the secondary gain thing. You know, I don't know. You can do a study and maybe find a little bit, but for the most part, just treat people well. So now when I'm stuck on the floor, I know I can't work too hard on getting up. So I do go to the, okay, what can I be thinking about? Math is always a pretty good distraction, or even just thinking and thinking happy thoughts, thinking about my grandkids or thinking about something coming up I'm looking forward to, but thinking about something intensely. And then it's sort of like the movement is an aside on the back burner that comes in, but I'm trying to train my brain to think about something else at the same time while I'm then just getting up.
Great. So math helps you, and I'm gonna, like, full disclosure, this isn't medical advice, right? Like, not everybody should just add by fives all of the time, and some people get worse with that. So
right, and that's
very personal, right?
Fascinating to me when I talk to some other people. I'm like, oh, I can't do that. That makes me worse. I know some guys who are athletes who they push their way through it. They're gonna do it. And I was like, good grief, I can't do that. I can't push. But maybe for some people that works. But I think you have to figure out your own brain. And that's why I like to think about just experiment till you find something that works. But for me, just trying to think about anything else besides the muscle movement. I was thinking about this yesterday, thinking about the next step. So rather than thinking about the steps I'm trying to take, thinking about getting to the doorway, going to the bedroom, going to the dog, thinking about my destination and not the steps.
That's great. Yeah, because that's actually how our brain organizes movement. It's goal oriented like that. Now, you also offered some suggestions for tremor in the blog post, and that's something that we see a lot. I wonder if you could share about that.
I did put a little in there because I know people do struggle with tremor. Tremor is not something I have dealt with, so I was a little uncomfortable even putting it in there because it was more passing along information. But I know the tremor entrainment test where you're having your tremor and then somebody tells you, okay, pat your leg, and then before you know it, your tremor is sort of going along with the same rhythm. So that's the entrainment trick, is using something else, and then you can slow it and hope and maybe even take it away. One of the things that whenever I have a neuro exam, I don't like to do this because it's so bizarre, but I'm going to show you whenever I have a neuro exam where I have to touch my nose, when I'm thinking about it, which you always are when you go to the doctor's office, it's when I'm the very worst because you're nervous and you're focusing and doing what they tell you, but my arm starts going ballistic. But what I will do is move the opposite arm. And so moving the opposite arm, then we'll stop the crazy movements. But usually I'll just tell a doctor, don't do that to me because it makes me go wacko and I don't like doing that. But wherever you're having a symptom,
anyway.
whenever you're having, and I can do it if I'm doing it as not thinking about it. If I have to talk, I talk really carefully and be sure I'm not thinking at all about what I'm doing. But if I stop to think about what I'm doing, it goes ballistic.
Yeah. Well, and that makes sense. Like, that's not how our movement is organized. So, and you've just so well learned that about yourself. I think that's really really brilliant. The last piece though, well, there's the two last pieces in the blog that I love. The other, you talked about brain fog, and this is such a common piece that people are experiencing. And you mentioned this like has stumped you before, but you got curious about that, and I would just love for you to share.
Well, and this is part of the mental games I play, and the being willing to accept that you're human and that sometimes your thought processes aren't helpful to you. And we all have them. In fact, my poor husband who's married to me, sometimes he'll say, you're just making that worse because you're just determined that that's how you feel and you need to, and most people, I guess, accept what they feel. I question everything I feel because I don't know if it's there or not. So when I'm having brain fog, it is a tough symptom. And often they go with migraines and it's tough. Sometimes you just need to rest. But I did notice after the conference, I came back and of course I had some brain fog. And then I had to ask myself, okay, did I have brain fog? Because I expected brain fog, because I told myself before I went to the conference, okay, you're going to this conference, crowded room, lots of information, lots of pressure. I'm by myself. I have no support with me. This is going to be a tough trip. And so my brain goes, oh, tough trip, got it, okay. And so I get home and I'm exhausted. Well, of course I am, because I've sort of set myself up for that. So I have to be really careful what I set myself up for and think, that was such a fun trip. But what I realized when I got home and I was having the tiredness, and everybody that I talked to after the trip also had brain fog and was exhausted, and they didn't have FND. That part of that is that's just normal life. When we travel, we get tired. But I realized that after I got home, I was so tired and I just didn't want to do anything. But I wanted to go check out how the garden was. And the garden was popping up and it was really exciting. Like, oh, look at this is growing, that's growing. And I realized after about 20 minutes of putzing in the garden, I'm like, my brain fog is gone. And it's because I'm not paying any attention to the brain fog. I'm paying attention to my garden. I'm taking joy in nature. I'm getting excited seeing things grow. And so I think, like any symptom, and that's how I try to think, any symptom that comes up. And if I get a new symptom, whatever comes up, you sort of have to say, okay, what do I know about my FND? What the other symptoms I've had, what has helped? And so putting my mind in a healthier, happier place, it just makes any symptom better. But that's the part of the mind thing you have to be addressing all the time. I just have to be really careful that I'm living a peaceful and life that's satisfying to me and doing the things I want to do, and really, I call it savoring the moment. This is another thing I tell myself, stop, we got to savor the moment. And so keeping yourself in that good nervous system balance is key. If you're in a bad place mentally, emotionally, your symptoms are going to be in a bad place too.
Yeah, really great point. So, I mean, I think you're right. Many people experience brain fog from all kinds of issues, even just jet lag, like you said. And just like the walking, just like the tremor, you found, well, if I focus on my garden instead of like, oh, my brain, I can't think, I can't, it. And I'm not going to make a gross generalization that like brain fog is only just attentional, right? Like there are, sleep deprivation, there are actual physiological processes, but we also know that there's a portion of attention that can play into the severity of it, I would say.
And there's times that doesn't work. When I have a migraine, brain fog, there's times and that's sort of at the end of the day, there's times when nothing works, and then I say, I'm going to bed. Tomorrow's a new day. That's plan Z. It's like sometimes you just have to go to bed and start over tomorrow. Yeah,
absolutely. Now, the last piece in your blog that I loved, it just says experiment. And you have you've done a lot of experimenting and it's taken you far with just, listening to your story. And I wonder if we could end by you talking about what that might look like for people, and what you suggest for people.
I think it's something that it's helpful for whatever your situation is, whether you have FND or not. There's sometimes I think of my story, or if I write a book, I think sometimes about it being N equals 1. When we're doing a study, we like to have lots and lots of subjects, but we are all our own study with only one subject. But the great thing about that is it's really the only one that matters, at least us personally. So I think whatever you're facing in your life, and it's sort of a life philosophy, is if something's not working well, what might make it better? And one thing that helps is doing research. I started on the computer 20-something years ago and there was nothing there, but now there is. Now it's loaded with information. So that's always a good place to start. See if there's other people who have experienced what you're experiencing and see if they have some things that you can try. And the other thing is just to notice, and this is the tricky thing. This is something Sarah and I were talking about yesterday too, about tracking symptoms. I'm sort of an anti-symptom tracker because I think the more we pay attention to, today I had 2 seizures and I had 3 yesterday. I think I'm getting more seizures than I used to have, or the same thing with whatever. If we're focused on what is not going well, then it's easy for us to notice that and for it to happen more and more. So I think we have to be careful about doing that. But at the same time, we can kind of notice trends. And so as we notice, okay, when I take time out to do some meditation or spend some time in nature, spending time in nature is one of my big things, or spending some time with my dogs or talking to a friend or whatever. I think I have some blog posts that I wrote a long time ago that have some sort of lists of suggestions, and I ask people to think of their own, because we all have those things that make us feel better. For some people, they love to go out and go to a concert or hang out with friends at a crowded bar. Not me. That's not my thing. That is not on my list. But for somebody, that might be a great distraction. So I think that's why it's hard to make those generalizations. But what you can generalize is everyone can experiment and see the things that make them function better in their own life.
Yeah, that's so great. I love that message. And Max, as we sign off here, what is the best way for people to find you on Facebook, Twitter, your blog? Because I think you're such a great resource. I'm sending this to everybody.
Oh, thank you. Thank you.
I think this is a great resource for folks, but maybe you can share where people can find you.
Sure. Well, my blog is fndrecovery.com, and on Twitter, I'm at fndrecovery. And my best email probably is fndrecovery@gmail.com.
Okay, that's great. So fndrecovery.com, that's where I found this great blog post and reached out to you too. So
I appreciate that. And I would love to have people who are listening. I love it if you can use it as a resource, because I do think it's unique. I mean, when my fees were all due again this year, I thought I'm going to keep paying, because I don't know of another blog that takes the goal of helping people get better and moving past it. I think there are a lot of people who talk about how horrible it is to have FND, which it is, but there are some things you can do to help. And so I think it's unique to have a patient who knows what it's like and how frustrating it is, but then to be able to say, but this is just a wacky way our brains work, and we can figure out some things to help it function better.
Yeah. Oh, what a great explanation. This is a wacky way our brain works, which is so very true. Well, I think you have already helped so many people, and you're going to continue to help more. I'm excited to share this video with the folks that follow us as well, and we will keep the conversation going. So thank you so
much, Julie. Thank you for
Yeah,
inviting me here. I
thank
appreciate
you.
it. And thanks for everyone for listening.